everyone. Thank you so much for taking the time to join us today for navigating telehealth in relation to billing. So I'm going to give everyone just going to give a couple seconds for more people to funnel in before we get started. Okay, great. And we are right on the 12 o'clock dot. So again, for those of you that are new, I just want to thank you for joining and taking the time to listen to us today. So today we'll be talking about billing as it relates to telehealth and the COVID-19 crisis. So I'm going to take a second to walk through what the webinar will be about, and then we'll do our introductions, and we have about an hour. So we'll jump right into it. So today we will not be answering product-specific questions. So this webinar, we're lucky enough to have our expert host here, Barbara Griswold, and we will not be discussing things related to SimplePractice's product. So that means we will not be discussing enrollments or payment reports as they relate to SimplePractice. For those questions, I recommend going to support.simplepractice.com. Take a look at our resources there, as well as our classes that we offer, including getting started with insurance and our insurance Q&A, which is with our customer success team and can help you with those product-specific questions. Okay, so without further ado, we'll start with some introductions. So this is the agenda for today's webinar. Like I said, we have an hour. So we had over 1,500 people register for this webinar, so we had tons of questions, and we went ahead and pre-selected some questions that represent the majority of the questions that were received. So we'll take the time after we introduce ourselves to go through these pre-submitted questions. They cover categories such as coding, coverage, documentation, out-of-network coverage. So stay with us. We have a ton of really great information to cover. If you don't see your specific question, we hope that the questions that we selected are representative of the questions that you have. And at the end, we'll use our remaining time to take live questions from the audience. So Barbara, I'll hand this over to you to introduce yourself.
Well, maybe you should read this slide, and I'll read yours. How about that?
Okay. So Barbara Griswold is our co-host today. She's a LMFT and an expert in insurance, as well as the author of Navigating the Insurance Maze, the Therapist's Complete Guide to Working with Insurance and Whether You Should. So if anyone is new to the field, Barbara is an expert in billing in mental health, and we'll be here to speak from her own experience.
And she needs to learn to turn off her phone number. No, that's me. Sorry. Oh, and Maggie has been working in the healthcare industry for 5 years, cares deeply about making healthcare services accessible to more people, and to her, insurance education is a vital element of public health. She believes empowering providers to take on insurance will open the door for many more people to receive care. I couldn't have said it better myself, Maggie.
Thank you so much, Barbara. And so I am a SimplePractice employee. I've been working for SimplePractice for about 3 years now. So that's my representation in this group. So let's get started to what we're all here for, which is the questions. The first category we'll be talking about is coding. So I'll read the questions off and Barbara will answer them, and we'll kind of talk through them. If there's anything related to SimplePractice, I'll be able to jump in and discuss from my experience. So question number 1, what CPT codes should I use for telehealth sessions?
So I get a lot of questions about this, Maggie, and people are like looking feverishly through the CPT code book. And this is one of the only easy questions that I have to answer, which is you use the same codes that you use for an in-person session. So if you did a couples telehealth session, you're going to use the same CPT code that you would use if you saw them in the office. So that's the really neat and easy part of this, is you don't have to go out and learn a whole new set of codes for the CPT codes. Now remember, the CPT codes, not the diagnosis codes, people sometimes get them confused, are the ones that tell the insurance plan what kind of service took place. Was it a 60-minute individual session? Was it a couple session? Was it a 45-minute individual session? Was it a group session? So it's those 5 digits. So primarily people are going to be using the 90834, 90837, 90847, those same ones that you use for in-person. So just easy transition for us, I hope.
Yep, and that makes sense. And I think that one thing to keep in mind with this is that the services that we're offering don't change. Is that right? It's just the modality. It's just how it's being delivered. So that's
right.
Okay. So our next question is, I want to know the best ways to bill for telehealth visits using place of service code 02 or 11, modifier GT or 95. What is the difference? What do all these numbers and letters mean?
So actually, this is probably the biggest confusion area. A lot of people hear about place of service code, they don't even know what it is. They hear about modifiers, they don't know what it is, they don't know where it goes. Do I need to use them? What is the right one? Blah, 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 blah. So this question is going to take a little time to unpack. So be patient with me. Okay, so the bottom line is that if the CPT codes are the same for a telehealth session as they are for a non-telehealth session, how is the insurance plan going to know that it was a telehealth session? And sometimes, in some cases, they might cover one and not cover the other. They might not cover a telehealth session. So you need to have some way to indicate that it was a telehealth session. So there's 2 ways to do that on a bill or a claim. One is called the place of service code. And for those of you who use a CMS 1500 form to your in-network, you probably don't even know, but from the very beginning, you've always been using a place of service code 11, which says that it happened in office. Well, for most insurance plans, you're now going to have to change that to say that the place of service code was 02, which is telehealth. Now, not all plans want you to change it. This is the crazy thing. Certain big plans like Medicare, Regents, certain Blue Cross Blue Shield plans like the Blue Cross Blue Shield of Louisiana, but not other Blue Cross Blue Shield plans. So, you have to kind of go to the plan, and we're going to tell you how to do that, but and figure out what place of service code do they want me to use. But for the most part, generally, they want you to use telehealth. Now, Medicare said, no, stay at 11, because if you go down to 02, you're going to get paid less, and we don't want that to happen. Just stay at 11. So at first they were telling everyone, go down to 02, but now, no, stay at 11. So that's one way that the insurance plan is going to know that it was a telehealth session. The other way is that very often, pretty much almost always, they want you to put a modifier next to the CPT code. So, and the modifier that indicates telehealth would be either GT, which is the old one, or 95, which was the one that theoretically replaced GT, but yet some plans still want GT or will accept either one. Now, I get a lot of questions. Well, what's the difference between GT and 95, and how do I know the difference? I mean, how do I know which one applied to my situation? Well, again, they mean the same thing. They basically mean it was a telehealth session, and there was, it's just one was the old one and one is the new one. Most plans will accept both. Some will only. I would say if you don't want to research it at all, I'd go with 95. That's more accepted. But there's a couple plans out there. I'm looking at my thing here. Yeah, United Behavioral Health has said, at one place they said that they wanted the GT only, but other people have told me that it got 95 was accepted. TRICARE has said that they want the GT only. So, again, this highlights that you need to go do some research and find out what the plan that you're billing wants.
Yes, and we'll talk a little bit more about how to manage that information and where to find it.
Well, I think I stuck the slide about it. The next one should be where to find out.
Not yet.
Okay.
I think that's a little bit later when we talk about coverage.
I think
For
I
those of
do.
us taking notes, can you tell us where the place of service code and the modifiers go on a claim form?
Sure. If it's on a CMS 1500 form, their place of service code is like right on the same line that you're reporting the service that you did. So there'll be the date that you provided the service, and then it's just a little bit over. There's a column, I think it's 26B, whatever, and it says place of service, and that's where you're going to put it. And it probably right now, if you have a billing software, might pre-populate with 11. You may have to change that. And then in terms of the modifier, there's a place for the CPT codes, as you all know, on the form. And right to the right of that, there's a box that says modifiers. So it's the first box to the right of the CPT code. Don't try to shove it all into the CPT code and say 9083495, or 90894 GT. Don't put that all in the CPT code. There's a separate modifier box on the claim form. Now, what about all you out-of-network folk? A lot of people, in fact, one person just today said, I don't have a place of service code on, column on my super bill, or I don't have, where do I put the modifier and all this stuff? Well, I would really advise people, out-of-network providers, to add a column going forward for place of service code, so it's nice and highlighted. But if you don't have one, and you at least write in place of service code 02, so it's very apparent, and then put the modifier next to your CPT code with just a little bit of space between. You just have to make it super clear to the insurance plan that you are clearly and billing for a telehealth session. You give them 2 opportunities to catch that.
Yeah, I would say you can never provide too much information.
Right.
So, and for those of us that might be looking at a claim form right now, it's 24B is place of service, and 24D is the CPT modifier designation there.
Right.
So let's look at question number 3, which is adding 95 to the CPT enough? And this kind of speaks to what we just discussed about some of the other.
Well, yeah, and I would say you still need to do the place of service code, because sometimes if you don't add one or the other, they will kick back the claim, or they'll pay it incorrectly. So
look at the place of service. Next question, what about phone sessions? Are they coded differently, and will they be covered?
Yeah. Well, I'll take the second question first, which is, will they be covered? So as we all know, because of the coronavirus, telehealth is now being covered at a rate it never was before. And the same thing with phone sessions. Most insurance plans wouldn't even think of covering phone sessions. And now, basically a lot of us said to the insurance plans, hey, yeah, I know you guys want us all on video better than, but so a lot of people are not set up for video, or a lot of people don't have Wi-Fi, or a lot of our clients don't have the ability to do video sessions, and they're sheltering in place. And so there's a lot of pressure on the insurance plans to cover phone sessions. So I believe, yes, they're going to be covered. Excuse me, most of them are covering phone sessions. I don't believe they're going to be covered after the pandemic, but I think they're going to go back, because I think there's more of a, they want as much, well, they want as much data as possible in that session. And obviously video provides a lot more data to you as the therapist. But in any case, they're going to really want to. So what about phone sessions? Are they coded differently? For the most part, no. Almost every plan, you're just talking about telehealth, and telehealth really usually means phone and phone or video, excuse me. So if you always need to check with the plan, but if the plan is covering phone, you just code it the same way. Now there's a couple plans, again, thinking of MHN, who wants you to use a different code for that. Magellan says that they want GQ for the phone, like a different modifier. So that way they can tell that you've used the phone, but only when you're doing video via non-HIPAA compliant platform. So they have, every plan has their little thing, and you just need to figure it out. And don't worry, we're gonna help you out with where to figure out what the different plans want.
All right. So our next question, or the next category we'll get into is coverage. And so this has a lot to do with working with those plans and finding that information. So question number 5 is there a way to determine if telehealth is covered on a client's policy without having to call the insurance payer? I know that everyone is hoping the answer is yes, but
Well, obviously, the bottom line best answer is to call each insurance payer. But I'm aware, because I've tried it, that getting through has been very difficult, getting through to a live human being. And if you get through to a live human being, very often they don't know. And sometimes they even give you wrong information. And sometimes you'll say, well, okay, well, how do I code it? If it is covered, what modifier do you want? And sometimes they're kind of snarky and they'll say, well, I'm not a coding, I'm not a code biller. You need to come up with the codes, and I don't think they're meaning to be snarky as much as that they're taught not to give out. They can tell you if a code is covered, but they can't, for the most part, give you codes. So you're going to have to go to them and say, sometimes they will though, so the best way to determine is still going to the health plan. Most of the portals don't seem to be able to tell you if telehealth is covered, but what I did is I tried to put together a list of every major and minor health plan in the United States and contacted them about their telehealth policy, including, what is their what is the coding that they're requesting, and are they covering copayments, which we'll talk about later, and this and that and that. And I put it together in one place online and I update it as regularly as possible. So we're going to give you that link. I think is it the next slide?
Let's see.
She's going to say,
Yes.
no,
Yep.
still not yet.
Oh, well, this is just where you can go to find.
No, this is it. This is it. So this is the link that we're talking about. My online list that you guys can go, and I check back frequently because I do update it. And it's theinsurancemaze.com. That's my website. Under telehealth policies, if you go to that link and look under, let's say, Aetna or Blue Cross or Cigna, you should be able to find, what code are they asking for, and a link to the latest information about their coverage for telehealth. Now, some of these I got, and the other way you can do it is that you can just go to the provider website for that plan, and it's amazing. I have to give it to the plans. They're doing a pretty good job of putting telehealth information and coding and billing and stuff like that for telehealth online so a lot of it, I'm just giving you links to what's already there. So you could just type in Aetna telehealth coronavirus, and you'll probably find what you're looking for. So, you may think it's miraculous what I put together, but it's just a matter of spending the time, and you can do the same thing yourself. So.
Yep. And when you consider a lot of these insurance companies were put into these positions in the same way that the rest of us were unexpectedly to cover this, it has taken some time, but I think that they have been some better than others, forthcoming with the information. So another
Finally,
thing,
yes.
yeah, it's taken some time, but just like getting used to telehealth. Another thing that we recommend is to keep a cheat sheet for yourself. So Barbara's list is very comprehensive. It has almost every Blue Cross payer you can think of. You may only work with 4 or 5 payers. So to help you keep track of this information, we recommend creating a cheat sheet for yourself so that you can keep a list of the plans that you are billing for, that you are either contracted with or submitting claims out of network, and then keep track of those rules. And the most important thing here is to make sure that you check back frequently and you keep track of the last time you updated that information, because this information can grow old pretty quickly. So it's important to put the source of your information, whether that's Barbara's site or directly linking to the payer. And then additional notes. So This is where you can put if you had to call and you received additional feedback or different guidance, just to try to keep track and make sure that you're not getting Aetna and United Healthcare and all those different roles mixed up.
Yeah, this is really, I definitely recommend something like this.
Great. So let's look at our next question. What questions should you ask the plan when verifying telehealth benefits, and what questions should clients ask?
Yeah, those are two different questions. So, sometimes people say, well, to their clients, well, why don't you just go check your telehealth benefits and come back to me? I am much more about covering my financial butt. So there's all kinds of questions that I believe therapists are more suited to ask, and particularly if you're a network provider, there's ones that your client's not going to even understand the answers that they might get from an insurance plan. So I think for these kind of situations, you probably need to make the phone call if they're an out of network person, and maybe you can teach them what to ask. But okay, so let's start with what should you ask besides the usual stuff, which is what's the copayment and deductible and claims address, and let's assume you've asked those things when you started therapy with this person. At this point, I'd be calling back and saying, are phone and video covered? Have your CPT code ready, and for how long will they be covered? Because some of these have definite expiration dates on them. If you look at the plan, it'll say we will cover through July 1st or something, and you want to know that so that you don't continue to give telehealth and they're not even going to cover it. So that's very important. You're going to ask about the modifier and the place of service codes needed. As we said, sometimes they're going to tell you, sometimes you're going to have to say, you're going to have to provide them and say, is that the right one? Are there any limitations or conditions? This one, like, do they need you to be on a provider telehealth list? They've pretty much waived that recently, but I think they're going to start requiring that again, where you have to sign up to be on their list, or that that there's something else like that. We're going to be talking more about this one, but is the copay waived for clients right now? And we will talk more about that one, and for how long. So those are the main questions that you're going to be asking. Now, in terms of what the client should ask, SimplePractice has put together a lovely download. I'll let Maggie talk about that for a minute.
Yes. So on our next sheet, we put together a link to our blog here, and if you search for telehealth insurance, we have created a guide for your clients. We've also created a guide for clinicians, which is a script for checking benefits. One thing I think that's important to consider is that if it's frustrating for you and it's annoying for you, think about someone who doesn't know what a CPT code is, or who has never had to understand what those are, trying to then navigate verifying whether or not this is a covered service for them.
Right, right. Or a modifier or a place of service code, yeah.
Exactly. So we do have this guide that you can include in your intake process for your clients to walk them through verifying their coverage, but we also have one for you as well, to just help you keep track of things that you might want to consider when you're on the phone with an insurance company. Okay, so our seventh question, this is a question that we got 100 times over. Are plans waiving copays? Starting when? And if they waive them, will we still get paid our full rate? If they don't, can we waive them? So Barbara, there's a lot of questions in there.
Yeah. Okay, so we'll unpack them one at a time. Are insurance plans waiving copayments? Some of you have heard about this, some of you haven't. Many insurance plans decided that, especially during shelter in place, they really wanted to incentivize people to use telehealth and to get assistance, so that obviously people are getting treatment. So many insurance plans across the country said, we're going to waive your copayments. We're not going to make you have any copayments. So basically, telehealth will be free to you. Now, we're specifically telehealth, though. For the most part, they didn't waive copayments for people who continued to come to sessions. They really wanted to incentivize people to do telehealth. So that was cool, but it also made things super complicated for the rest for those of us out there, because first of all, you have to say, well, when do they start? For the most part, all the insurance plans I work with started about mid-March, like, and you can look at them and they're like March 17th, March 15th or so. So if you saw clients in person up until then, they're not going to waive the co-payments for January and February probably. You're probably going to see something for the plans that are waiving co-payments. Now, are they waiving deductibles too? In the plan, the clients that I had, they didn't waive people deductibles, but maybe other people plans did, but they waived co-payments. But remember, they have to see on your claim that it was a 02 place of service code and a 95 modifier. So when I screwed up and continued to, by accident, put the wrong modifier, the in-person modifier, they took out the copay. So you have to, that's another important thing. Okay, so if they waive them, will we still get paid our full rate? This has been a big concern. Oh, well, if my client's not paying me their $20 copayment, am I just out $20? No, the insurance plan makes up that $20. So if my usual fee for the insurance plan is $80, that's my contracted rate, and the client usually pays $20, and I usually get $60 check from the insurance plan, I should start getting $80 checks from the insurance plan. So they're basically picking up the whole session. Now, if they don't, can we waive them? That part of the question. So can you waive a copayment if you want to? And I think most of you would say, you would guess that the answer would be yes, and the answer is actually no. For the most part, you cannot waive a client's copayment. It's part of their contractual agreement with the insurance plan that it's part of your contractual agreement that you will collect copayments. Now, if a client can't pay and you've made several attempts to collect, that's a different situation. But you can't tell the client, hey, you don't have to pay your copayment. I'll keep meeting with you and just billing the insurance plan. If you can see, if you look at it, that you're billing the insurance plan as if it was an $80 session and you never intended to collect $80, and so it's kind of insurance fraudy, to coin a word. You're really, only going to take insurance with what you're collecting from them. So you really can't waive co-payments, unfortunately.
Okay, and this is specific for in-network providers, is that right?
Right, because out of network doesn't have a co-payment. Out of network, you can slide fee ups and slide fees down, and you can charge a person nothing at any time. You have complete reign over what the fee is that you charge clients. But when you're in network, those copays are set already before the person even comes to you.
And it all comes down to that contractual agreement.
Yes, it does.
All right, so let's talk about documentation. And this is a question we also received a lot. How will my documentation change with telehealth?
This is a question I get a lot also, and people are kind of shocked by one of the answers, which is that overall your documentation should be the same. You provided the same service in that the client, you want to document what the client said about their symptoms, what is the topic that's going on in their life that they discussed, you're documenting that. You should be documenting your interventions. What did you say in response to that? What advice did you give, or what interpretations did you make? How did the client react? What was their general there's lots of things that you could document depending on so your documentation in the progress notes should be almost identical. Now, there's a couple of things that I'm going to tell you that you need to add. One is that you need to document what type of session it was. Most of us don't even think about that. You should document that it was a video session if it was a video session. So the first word should be video session or phone session. Okay, so you want to make it clear very quickly that this was not an in-person session. The second thing, and this is one that most of us don't know to do or forget, we're supposed to verify a client's address at the time of the session. Why is that? That may seem very strange. But bottom line, if your client suddenly melts down in the middle of the session and gets suicidal or whatever, says, you know, the world, life's not worth living anymore, and hangs up essentially, you know, do you know where to send help? Do you know if they were at Starbucks? Do you know if they were at their mom's house? Do you know if they're at their dad's house? Where would you send help? So at the start of every session, you should ask them the address, the street address of where they're at. Now, if they just say, I'm at my home, and you know where that is, good. You just kind of check in with that at the beginning. But, you know, a lot of our clients, we don't even know that they're in another state, or they're in another, and that's another important thing. Maybe they've gone to another state and they're calling in and you didn't even realize that, and maybe you shouldn't even be doing that video call because of that, because it's an out-of-state situation. So you should be documenting that you verified the client's address. That should also be just like standard. Verified client's address, and maybe writing it down even. You should be also documenting any discussions that you have about the pros and cons of telehealth with that client. I think sometimes we're a little cavalier that telehealth is fine for everybody, and we don't really document the discussions we've had about the pros and cons for that particular person and how they'll manage privacy, or how they'll manage whatever potential consequences that could maybe make it not so good. I have one client, for example, who, you know, he's very severely mentally ill, and sometimes I've seen things by the way he walks into the room, or that he's had bruises on his legs or whatever. And, you know, we had to have a long conversation about video and how he's going to have, I won't be able to see his legs when he comes in, you know, and what are some of the downsides for working with different clients. And so these are the type of things you want to document. Right. It doesn't mean you shouldn't do it, but just make sure you've kind of thoroughly documented your discussions. I also recommend both an informed telehealth informed consent. I have one myself that I put together, and it just goes over some really great points, I think, that clients should think about. It shouldn't just say, I agree to informed consent. I mean, I agree to telehealth sessions, which, you know, that's verbally, or we don't necessarily legally have to. Different states are different on this. Have one, and they've sometimes, but it's a really good idea to just have that outlined, what the clients can expect, how to have a good phone call or video call, etc. And the credit card authorization, I would say, should be in your documentation, because, you know, first of all, clients may, yes, it may be the best way to collect for clients who are no longer handing you checks or cash, and then otherwise it's just a good thing for missed sessions and other things like that. So
yes, and for anyone who is not currently using SimplePractice, we do have those built into the system. You can customize your own consent form. We also have a templated one, as well as a credit card authorization. So those are great bits of advice there. Should we move on to the next question?
Sure.
Okay. Here we go, a free list of giveaways.
So what I decided the last minute, like 10 minutes before we started today, I thought, oh, people are giving up their middle of their day. I should give them something to walk away with, other than my telehealth policies page. And so for you guys especially, I wanted to just give you a free list of interventions. A lot of people tell me they have trouble kind of articulating what it is they do in session. So this came under the documentation. And I thought, oh, I'll just give away my list of interventions that are kind of more subtle than others, because you should write down some intervention that you did in each session, other than supported, validated. These should not be, you know, that's expected. So I just want, you can go to my contact page and just say, I want you to send me the free list of interventions, and I'll be happy to send those out to you guys.
Awesome, and we'll include that in our follow-up email too. We'll include the link here, as well as your contact info.
Okay, great.
All right, so now another really hot topic, out of network coverage. We got a ton of questions about how out of network billing works for telehealth. So we talked about it a little bit, but let's go a little bit further. What about out of network providers? Are they covered for telehealth?
So there, I would say, you know, looking through all the health plans that I talked to or that I got emails from, for the most part, they're not warming up to covering out of network providers. Most of the big plans seem to want to only cover network providers. Now, some are covering out of network providers, again, because they're kind of taking a remove any barriers approach. But you can understand that they have already, they want to encourage people to go see their network providers who are going to cost them less, number one, and who they've already kind of vetted in some basic ways. So I would say if I was an out-of-network provider, I would definitely be checking or having my client check what the exact, I personally would be checking because I want to ask more questions than I can teach my client to ask about the coverage and whether deductibles are going to be waived for my client, and, or excuse me, the copayments are going to be waived and different things like that. Definitely you can start by going to my page, and at least it'll give you some basic information, sometimes for out-of-network providers usually. Now, let's just talk again about what do you need to do different when you are billing for telehealth. I mean, that's the bottom line is when you submit a bill and you put all the right things on it, whether it's paid or not is going to be your final arbiter of whether if they're covering it or not. So
Right.
you're going to remember to put that extra, you either have to write somewhere on their place of service code in a very, you know, 02, if that's what the plan wants, for each date of service. So they know each one was, you're going to have to write the modifier for each date of service as clearly as possible. Now, also, if your super bill has a description section on it, like what was, if it says 45-minute therapy, you want to change your description so it says 45-minute psychotherapy via telemedicine or via telehealth or via video. So again, you want on your super bills, I hate that term. Let's get rid of that term and replace it with statement, because no one wants to receive a super bill.
An insurance reimbursement statement.
Yes, insurance reimbursement statement. We want to basically say as many times as possible that that was a video session or a phone session, so that you are giving the insurance plans the opportunity to process it correctly. Now, don't try to hide it. If you hide it in any way and they figure out later that you did, you don't want the clients to, you don't want the plan to be coming back to the clients or you, depending on who is getting paid here. And they feel like you've hidden somehow that, and they paid for something that they wouldn't have normally paid for. So.
And I will say, so I used to bill, and I also used to work at an insurance company. So what I find is that it's helpful to point out the things that you really want them to see, and I will highlight and I would circle and I would you know, make sure that the ID number is there for the client, as well as the place of service and modifier, because when they get it, when the plans receive them, they just scan it into a computer. So when you're talking to a representative and you want to say, can you pull that up? That's exactly what they're looking at. They're looking at a scanned copy of the piece of mail you sent them. So if you write it in big bold letters, circle it, highlight it, then they shouldn't be able to say that that information was missing or that this was denied because it didn't have a modifier or a place of service, if it is covered. All right, so let's see. I think we have moving on to denials. So there may be some of you here that have been billing since the start of all of this in March and have received some denials or have received no word back. So let's talk about what do I do? How do I resubmit a claim if I made a mistake?
So basically, if you didn't change the modifier or you didn't change the place of service code and it was processed at the wrong level, see, the copay was taken out and it shouldn't have been, or whatever mistake you make, and this is going forward, telehealth, non-telehealth, there is a way to submit a corrected claim. So on the CMS 1500 form, there's a box number 19, and it's one that we don't usually use. And in box 19, you're going to describe why you're resubmitting it and what's the error made. So something very short. They don't give you a lot of room, but it could just be resubmit wrong POS code on original claim, something very short like that. And then in box 22, so we've got 19 and 22 are going to be the changes. You're going to put a 7, and the 7 basically means this is a resubmitted claim. And then right next to that, there's like a vertical red line, dashed line, and then to the right of that, you're going to put the original claim number. So you're basically going to submit a claim that has everything right this time. So you do it as if you want it, how you wanted it to be, but you're going to make these little changes in box 19 and box 22, and then resubmit it. And hopefully this basically will make it so that they will make any adjustments. If they underpaid you, they will hopefully adjust it and pay you the difference. If they denied it completely, they will hopefully process this one and you'll get paid.
Yep. So yeah, it's usually as easy as that. I would, if you don't know where to find the original reference number for your claim, it's usually on your explanation of benefits that came with your denial.
Right.
Or you may have to call the plan.
Yeah, it should definitely be on the explanation of benefits, or if you use Availity or one of the other portals, there's the claim number is there. So.
All right, so let's see what other questions we have. I used the 9.5 modifier and the O2 place of service code. Why was my claim denied?
Well, Jacob, I have no idea. I don't have a crystal ball, but I would say it could be that this is one of the plans that wanted a different place of service code or a different modifier, or it was denied for a completely different reason, like that the client didn't pay their premium, or that would be my guess. It's something totally unrelated to your lovely coding. Maybe you did your coding right, but there's lots of reasons a claim can be denied that have nothing to do with your coding. So I guess you're gonna have to call on that one.
Definitely, and a place to find out would be your explanation of benefits. If you get that in the mail or if you get that electronically, that should have some answers for you. And
or
if you
not, or it's very vague and you're going to need to call the plan. So
yeah, I was gonna say, and if you didn't receive anything back, that sounds like a phone call. And a lot of times they'll have to guide you on whether or not it was a flat out denial or whether they just didn't even process the claim and it got tossed out because they couldn't identify the member or it was going to the wrong plan. That's also something that happens.
Yeah, or you typed the wrong number when you were putting the ID number or something. It could be anything.
World of possibilities.
A world.
All right. So now we're on to payer information. This is something that we talked about a little bit too, but we get tons of questions asking about very, very specific, my Blue Cross Blue Shield of Louisiana claim XYZ, why is Anthem telling me this? And here's some information. While we don't have we can't answer every single specific question, we can kind of guide you into where to find this. So how long will plans continue to cover telehealth and waive copays? Will insurance continue to pay for telehealth after COVID-19? And this is another of a little bit of a crystal ball question. But.
Yeah. Well, the how long will plans continue to cover telehealth and waive co-payments? Some of that answer is going to be on that page that I gave you, which is the telehealth policies page. Is that for now they were saying, well, we'll continue to cover it. Let's say if you looked up Aetna, I'm just going to make one up, and they said we're going to continue to cover it through May 1st, and then they came back and said we'll cover it through June 1st. And then they came back and said, we'll cover it through July 1st. So I think what you're seeing is that they're taking this, a lot of these plans are taking it like 1 month at a time because they don't know what's going to happen. So that's the importance of continuing to check back with the plan and seeing how long are you going to cover them, and how long are you going to waive co-payments? So there's really no answer to how long will all the plans continue. It's a plan by plan answer, and you're going to need to kind of keep your finger on the pulse. Will they continue to pay after COVID-19? Like, your guess is as good as mine. My guess is that this has opened up the eyes of the insurance plans and insurance plans members to video as a solution for getting mental health services. And I think it's going to be very hard for them to get the genie back in the bottle after. I think members are going to want it. I think, providers are going to want it and see that it's very appropriate for a lot of our clients, not all, of course, but definitely I think they're going to see that it's cost effective. So I think we're going to see expanded telehealth coverage, but I think they have been slow to do it because of a couple things. Maybe most prominently that I think it's a higher level of malpractice. I think they're a little concerned about liability when the patient is not being physically seen, when there's ways for us maybe to miss some indicators of problems because they're not physically in our presence, and there's not a way to immediately intervene with a client who is clearly in distress right in front of us. So that would be my kind reason why they probably haven't embraced telehealth as they should have in the past. But I think we're going to see a huge increase in telehealth coverage. I don't think we're going to see a huge increase in phone coverage, though. I think they would like to move everybody over to video.
Yep, that makes sense. And I think another can of worms that we barely scraped the surface on, but practicing across state lines, that's something they're also wanting to
they've really loosened a lot. A lot of the states have loosened this practicing across state lines rules, but they're not all of them have. So there's a wonderful resource called personcenteredtech.com. So personcenteredtech.com. They have a list of 50 states and how they're dealing with the COVID interstate rules, like how each state is dealing with allowing interstate telehealth. So you may just want to, or just for me, I just type in 50 states, person-centered tech, and it'll come up. But it's a great lowdown by each state and what their current rules are for telehealth.
Well, we'll definitely make sure to get that included in a follow-up email as well. We'll try to include everything that we mentioned.
Okay.
All right, so the next question is, will I get paid the same amount for a telehealth session as an in-person session?
One would hope so, right? But only 16 states actually mandate payment parity. This is called payment parity. There's different kinds of parity. There's coverage parity, but payment parity, there's only 16 states mandated for private payers. I think that a lot of them are stepping up when it comes to telehealth right now, and you would hope, but I have heard from a couple people saying, that I'm not getting paid the same. So it's something that hopefully after this that you can mandate through or lobby for, through your professional association in your state, if you're not getting this. But this is a state by state thing. Here in California where I'm at, we have payment parity. So.
Okay. So again, it depends on where you are and who you're working with.
Yeah.
Okay, this might be one of our last questions, but how do you manage it when you have different insurance reps giving conflicting information? And I know that this doesn't just speak to telehealth, but this is something that happens quite frequently.
Take a Paxil. I don't know. The answer is basically, there's nothing that you can really do. This is going to happen across the board, is when you get different conflicting information. I don't know what to tell you. You try to find a third party or go higher above them, talk to a supervisor, email. I've had surprising luck with emails. What I do is everything I get from the insurance plan, I've been in insurance plans for 30 years, everything I get from them, if it has a person's name on it at the bottom or a phone number or I write that down. So I have a document that basically has, contact information for every plan I work with, and it keeps getting updated. And so that when I have questions that I can email, and it's amazing how many people actually at the plans actually respond. So that's another thing you might do. So that way you have it in writing too. That's a really nice thing about it. Like if you have, what
Mhm.
CPT code am I supposed to use for, not what modifier am I supposed to use for telehealth? Sometimes I have an email now from the head of provider relations, and that's nice.
And that would be my recommendation too, is never give them an opportunity to dispute what you heard. So have a reference number, have the name of the representative, um,
Yes.
always. And so
When
you can
you
say,
call
if they say
them,
that wasn't true, you can say, well, this is the date, this is the person I spoke with,
yeah,
you
I
know.
have a quick story about that. One person I always call at the beginning and check a client's insurance. And I called and they told me, I asked about deductible and they said, no, she had no deductible. I filed the claims. They took out deductible. And I called back and I said, what's the deal? They said, no, she has a deductible. And I said, well, no, we met like 6 times at this point, and we were doing this on the thought that she did not have this huge deductible. And so I basically said, I have the call confirmation number from the first time. I have the name, the date that I called. And they went back and they listened to it and they said that I was given wrong information, and they waived, the deductible for her within my situation. So they paid. And this is the kind of thing you need to have: the dates that you called, you need to have the call reference numbers, and you need to hold their feet to the fire when they give you wrong information.
Definitely. And that information can be really powerful in an appeal. Otherwise, if you're just trying to appeal on hearsay, there
Hmm.
you won't hold hold much of a candle to them.
Right.
Okay, so I think that's the end of our pre-selected questions. So let's take some. We have about 10 minutes, so not a ton of time, but look into the group. And I have some questions here. So the first one, is there a different code or modifier for crisis or emergency sessions in telehealth?
No, the modifier just tells you it was a telehealth session, and the place of service code tells you, what kind of session. So none of these tell you what kind of session took place. So those are going to always be used for a telehealth session. So place of service code and CP and modifier would not change based on what kind of session you provided. So yes, there's a different CPT code for a crisis session, which is the
Mhm.
90839 and the 90840. If you want to find out more about those kind of other codes that we don't use as often, I do have a webinar about those.
So again, just the modality, not the service, is being changed. Okay, and then Marie asks a question for the end regarding telehealth. Should providers renegotiate with insurance companies fees for telehealth once insurance companies will not cover telehealth? So
Well,
should we
if
renegotiate?
insurance plans are not covering it, then you're not going to be renegotiating anything, because if insurance plan A doesn't want to cover telehealth, then why would you renegotiate a fee for telehealth? There's
Mhm.
no, they're not going to cover it, so the rate's going to be zero. If you're saying, should we put pressure on insurance plans to cover it if they're not covering it? Absolutely. So maybe I'm not, did you understand the question differently than I did? Did I not?
No, I think that makes sense. I think it's putting pressure on for coverage if they all of a sudden stop paying for it, and trying to reach out to them. Um, Okay, so the next question is, my remittance with Anthem is usually reliable every 2 weeks. Since the start of this, we have not received a remittance. Do you have any advice for that?
That's
Since the
interesting.
start.
Yeah, I've been actually impressed that they've been very on time. Um, as always, you want to just check the same way you would before the coronavirus. Check in,
Mhm.
make sure that they haven't had some kind of a mistake in terms of your bank account, if that's where it's going in, or But no, you should be receiving them fairly timely. I don't know if you're saying it's a week late or it's a month late, so you might give them
Yep.
an extra week or so. But
It may be something with the claim to follow up with, just to make sure.
absolutely, yeah. I don't know if this person's saying a whole bunch of claims and she's getting no payments, or he is getting no payments, or if it's just one specific claim. So yeah, if it's one claim, I'd definitely call about that. Actually, I'd call either way.
Okay, someone asked, let's see, a lot of therapists are giving up their offices to work from home. Can
Oh
we use
yeah.
a PO box or UPS address on our super bills?
Yeah, I just actually, this is another great reason to be on my email list, because I just did it in my last e-newsletter this week. Talked about home offices a little bit. So a lot of people are giving up their their offices, which makes a lot of sense. I think right now a lot of insurance plans don't want a PO box for their billing address. So you've got two addresses you put on a claim form. One is going to be the location address. If you're doing it from home, you should still put your office address. Don't put your home address anywhere on the claim form. So let's start there. We don't want your home address anywhere on the claim form, or that Starbucks you're doing it from. You don't have to put even though it says location, just put your office address. Okay, but what if you give up your office? We've got the billing address, and that's who do they cut the check to? Where do you want them to send the check? Now, obviously, if you give up your office, the next opportunity would be a PO box, but they are wanting us. Most plans, or I don't want to say most plans, but many plans don't want to set a PO box. So you're going to have to talk to the plan, whether they want you to put your home street address there, or whether a PO box would suffice. Somebody contacted me and said that there's digital PO boxes, and she was sending me some information where it gets forwarded to you. So you use their address, and it's just a forwarding scanning. But it seemed a little bit concerning because you don't want your mail scanned by anyone, especially this type of stuff. So I think this question is still up in the air. I don't have the answer to it. It's one that I would be calling the plans and asking them. I do know that you want to be careful, like what's listed on the directory. So I would be calling, let's say Cigna, if I'm working with Cigna, and saying, can you list me as a telehealth only provider? I don't want my, home address listed, obviously, and I don't want an office address listed if I don't have one anymore. So
Yeah.
you've got separate issues. You've got your billing address you need to talk to them about. You need the location, and you also have the directory, how you're listed there.
Yeah, I would say the one thing you don't want to do is just to chance it and try to bill
Yeah.
with a different address. You definitely want to talk to the plan first. Okay, Mallory asks, how many sessions can I bill at once based on 1 week? Bill for it once based on 1 week.
I think she's talking about coverage, like how many times can I see a client in 1 week and the insurance would cover it? Is that what you think? Is that how you interpret?
I think that makes sense. Otherwise, the quick answer is you can fit up to 6 sessions on one form. But I think that probably is a good question to answer regardless.
Well, insurance plans kind of lean toward once a week therapy. Let's just say that. If you're doing more than once a week and you need to do that for a little bit of time with a client, they're mostly fine with that as long as it doesn't last ongoingly. If it lasts for months that you're seeing somebody 2 or 3 times a week, you'll probably get a phone call from them, or they may send you something and question the frequency. And so you may trigger a bit of a questioning. Now people are like, oh no. Well, so what? They call you and you describe why. To me, I'm absolutely fine describing to someone the importance and clinical reasons why I am doing, more frequent sessions. So don't worry about triggering a treatment review if you can just describe, this is why I'm doing it. You're the clinician, and you need to give the best care. And if the best care means for this person at this time of their life, given what's going on, Now, if they just like to come twice a week because they're lonely and, you know, they like to chat with you and they bring a little Starbucks in with them, you know, then, you know, it might be hard to defend and the insurance may say, we don't really want to pay for that. Okay, then you guys make a decision about how often you meet, given what the insurance will cover. Now, if that's not the person's question, if the person's question is, how often should I bill, or how many should I bill for at a time? You know, I encourage people to bill as early and often as possible. Sometimes I talk to therapists who bill every 3 months. Such a big mistake, such a big mistake. Or every 2 months, or even every 1 month. I used to do every 1 month, and I've now gotten it down to every 2 weeks. I probably could bill more frequently, but first of all, you have a better financial flow of payments. Second, you just find out about problems so much sooner, and you're out less money if you can't collect from the client. You know, I've had clients who just didn't pay their premiums and they didn't know it, or their father didn't pay his premiums. I had one this week, oh, that one. And so you know, I don't want this person to be out hundreds of dollars or me out hundreds of dollars. It's easier to just have them pay for one session that, you know, there was a problem with. So find out quickly if there's a problem, and that to do that, you need to bill early and often. That's my, especially after the first session.
Definitely. So we'll take one last question, and then we'll wrap up here. But Tamika asked if we could re-explain waiving copays in terms of telehealth, just to add some clarity there.
Okay, so the insurance plans are saying we want you to go into telehealth as much as possible. We don't want you to go in person to a client's. They're saying this to the, basically communicating this to the members. We want you to go to telehealth. We're going to remove copay, which means instead of you having to pay your $20 copayment every time you go to see Tamika, you can now see Tamika by telehealth and you don't have to pay your copayment. So instead of the insurance plans, the client coming in, physically handing you her $20 check or cash, and then the insurance plan reimbursing Tamika this other $60 of her $80 contracted rate, Tamika should be getting a check from the insurance company for that session for the full $80. So they're waiving co-payments, meaning we want to make it free to the client. We're going to pick up the now, if you have already collected, which a lot of us had already collected co-payments from the clients, you're going to have to do some refunding. I mean, and that's something you're going to have to just, it's annoying and it's inconvenient, but we need to sit down and calculate which ones we actually got paid in full by the insurance plan, and we also collected, we over collected for that session, and we're going to have to refund our clients.
Yep, and that has to do with being held to the contract of what the insurance tells you to do.
Yeah, so, and it's just ethical. I mean, it's supposed to be 100%. Free. Yeah.
Okay, so that's the last question. We're running over time. I want to again thank Barbara for being part of our webinar today, and this is her website where we'll send you some information after the webinar of how to reach Barbara's website, but this is where you can find a ton of helpful information. I don't know if you want to say more, Barbara.
No, I just want to invite you with any insurance questions or notes questions or practice business questions. I usually will answer within 5 minutes. No, I didn't mean that. I mean, if it's a quick answer that takes less than 5 minutes, I'll just shoot you back the answer. There's no fee or anything like that. If you want to set up a consultation, we can do that too.
Great. And then if there are any non-SimplePractice customers on here, we invite you to try SimplePractice. We also offer a telehealth platform, so you can try it free for 30 days. We're an EHR with a telehealth add-on. And if there are SimplePractice customers in the crowd, or if you have any friends that are using SimplePractice, you can give a referral, and you will get $50 for referring, and the person that you refer will also get $50 towards their subscription.
Sounds great.
And that's all we have for you today. All right, everyone, thanks so much for joining. Have a great afternoon.
Yay, thanks for coming.
Bye.
Bye.